Hey guys, Stephanie Magno here with Redefining Health, physical therapist residing and practicing here. I wanted to bring to you today a little video here that's going to show you how to check at home if you have a diastasis recti. So if you're watching this video, you've probably already researched away and found out what the heck a diastasis recti is and maybe what are the problems that are associated with it. To give you a quick review, diastasis recti is a splitting of the rectus abdominis, which is that six-pack muscle on the outside here that everybody's after. So it's starting to separate. And some of the things that it can be a problem or involved with is low back pain is a big to-do. Sometimes even sciatica, pelvic instability, SI pain. The big one we work with is for moms, so that if you have a diastasis, then that means baby's probably not going to be lined up very well for birthing. So we work with getting this closed up prior to your birthing and even getting you prepared ahead of time to make sure you don't even get it in the first place. So that way baby is going to be in a good alignment and you're going to have a much easier, much more comfortable birth. So let's get down to how you do this. You're going to need to be in a space where you can lie on your back. You can do that on the floor or on your bed. I do what I call a slide and glide to get into position, and that's just to protect this abdominal wall so that I'm not worsening anything in here if I do have something going on. So what you're going to do is just go ahead and slide down on your side and glide to your back. Get your hair out of the way is one thing, right, if you have hair. All right, you're going to have your knees bent up. There's two things that we're going to check for. We're going to check how wide is that diastasis, if you have one, and then we're also going to check for how deep does it go. Is it just real shallow? Does it go moderate depth, or does it go real deep to where you can feel maybe your organs or something bony in there, or a pulse? So that usually means that it's pretty deep. This area can be tender, so just be mindful. So we're going to start with just 2 fingers, and you're going to place those with your finger pads facing you, facing your head, right at the belly button. And then right here you're going to just relax your tummy and let your fingers sink in as far as comfortable. And then you're going to lift your head just a little bit off of the table. If you lift too far, if you do have a diastasis, you're going to miss it. So you want to just lift a little bit off the table. So if you have a separation in the abdominal muscle, what you're going to feel is that muscle coming in on the sides of your fingers. If you don't feel anything with 2 fingers, try 3, try 4, even up to 6. You might need 2 hands, 7, 8. It can be really separated there. So that's one thing that you have to be mindful of. The other thing is, you know, if you put your fingers here and you lift up and you don't feel anything and you don't feel any sinking in or any type of a separation, you may not have a diastasis. So you want to check at the belly button level, and then you want to check 3 fingers above. So take 3 fingers right above the belly button, and then put your 2 fingers down again. Sink in, relax the belly, lift your head slightly, and you're checking for how many fingers can I fit in there, if you need 2 hands. And then you're checking for how deep, shallow, moderate depth, or deep. Okay? And then you also want to check 3 fingers below the belly button. So 3 fingers below, and then take your 2 fingers there, sink down, lift your head slightly. Is there anything going on there? All right? So that's how you essentially check for a diastasis. So once you check that, if you do have a diastasis, then you want to get in to see somebody if you don't know how to resolve it yourself. There are some online programs. We don't have any of that yet rolled out with Redefining Health, but it's in the works. We do clinic care here, of course, and we're happy to be a resource. So if you don't know where to go, you don't know what to do, just give us a call and we'll get you in the direction that you need to go to get it resolved, because it's really important to do that, especially if you're a mom or if going to be a mom, pregnant, looking at birthing. You really want to make sure that that is closed up as much as possible so that you have proper alignment so baby comes out nice and smooth and easy. Diastasis can also impact upper back pain, neck pain, because it has to do with posturing. So there's a lot going on there. It's a really significant component that is largely overlooked. So I hope that's helpful. Until next time, we'll talk to you later.